To chair our next panel, I am delighted to introduce Dr. Sean Reardon. Dr. Reardon is Professor of Poverty and Inequality in Education and a Senior Fellow at the Stanford Institute for Economic Policy. Dr. Reardon will introduce and lead a stellar group of researchers and innovators whose bios are in your programs in discussing new opportunities and approaches to childcare, classroom, and communities. And one thing I'd like to add for everyone, a recording of the live stream will be available after the event. Dr. Reardon?
Dr. Reardon. Good morning, everyone. It's my great pleasure to chair this panel with a group of 5 remarkable scholars and experts. The content of this panel, the topic is narrowing the income achievement gap in early childhood. So, as I'm sure you're aware, academic disparities as well as socio-emotional disparities are enormous between children who grow up in high and low income families. Even by the time children enter kindergarten, those disparities are enormous. They emerge in early childhood, and that makes the work of K-12 schools challenging to try to undo those. So one of our goals today is to sort of think about what can be done in early childhood to try to reduce those disparities. Those disparities emerge because children have different experiences in early childhood. Their families have different resources and are able to provide different experiences. They live in neighborhoods that are more or less able to provide supporting environments. They have access to better or worse health care. They have access to better or worse child care programs, preschool programs. All of those things are sharply patterned by income in the United States. Now, of course, those income disparities overlap and are layered onto the racial disparities we talked about in the last panel, but our charge today in our panel is to talk specifically about the economic disparity aspect of it. So because those disparities emerge from differences in children's experiences that result from their families' real differences in economic resources, the way to change them is to change the patterns of experience in early childhood. And so what our panel is going to talk about today is a number of promising strategies and ideas for how we can do that and how we can do that at scale. So I want to introduce our panelists briefly here. Their full bios are in your program. And I'll go in order in which they're going to speak. So Susanna Loeb is the director of the Annenberg Institute and professor of education and public affairs at Brown University, where she runs the National Student Support Accelerator. Before moving to Brown, Susanna was the Barnett Family Professor of Education at Stanford University, and I'm pleased to say, this is not in your program, but Susanna will be joining us back at Stanford starting in January. So we're very excited to have you back. An early welcome back. Second on our panel is Deborah Stipek. Deborah is the Judy Koch Professor of Education Emeritus and the former Dean of the Stanford Graduate School of Education. Her scholarship concerns instructional effects on children's achievement motivation and early childhood education. She currently chairs the Heising-Simons Development and Research on Early Math Education Network and is a senior consultant to the California Education Partners. Welcome, Deborah. Third is Rebecca Silverman. Rebecca is an associate professor of early literacy at the Stanford Graduate School of Education. Her research focuses on language and literacy development and instruction for diverse learners in early childhood and elementary school settings. She has served on state-level working groups in California focused on revising the preschool learning foundations and the California Teacher Credentialing standards, and currently serves on the board of the International Literacy Association. Welcome, Rebecca. Fourth is Matt Glickman. Matt is co-founder and a partner of Promise Venture Studio, a national nonprofit that supports innovators and accelerates innovations for equity in early childhood development. He's also a lecturer at the Stanford Graduate School of Business, where he teaches the flagship entrepreneurship course, Startup Garage. He is the founder and former CEO of Baby Center and Merced Systems. Welcome, Matt. And finally is my colleague, Frances Pearman. Francis is an assistant professor in the Stanford Graduate School of Education. His award-winning research focuses on how poverty and inequality shape the life chances of children. He's especially interested in how big data can be leveraged in ways that open up new sites of inquiry in the field of education. Welcome, Francis. So I would like each of you to take a few minutes and sort of give us your high-level thoughts on what we can and should do to narrow the income achievement gap in early childhood.
Okay, so thanks, Sean, and thanks for having me here today. It's such a pleasure to be here. This question is just such a huge question. I was like, oh my gosh, where do I start? So what I want to pick up on is what Sean said about the students' experiences and trying to think about changing students' experiences and what we want for children. And I think, of course, we want these positive learning environments that wonderful teachers can create, that parents can create, in which students can explore and grow. I think also we want to make sure, and this I'm going to focus on a little more, is that children get the individual experience, the individualized supports that they need. So students vary a lot in all sorts of dimensions in their capabilities, and they come into classrooms with different needs. They exist in the world with different needs, and they thrive by having adults that they trust, that care for them, that know their needs and can address those needs. And we need to make sure that each child has that adult or those adults that can reach them. And I just want to give you a couple of examples of this. So it's clear across the different things that students need to develop that they benefit from this individualized attention, but it's particularly clear in early reading. Kids come into schools, for example, at very different stages in learning to read. And by having someone who can target their needs, they can really make advances quickly. So I've been looking at one program in Florida that's serving a large number of students. And we did a kind of experiment to test whether it had an effect. And this program puts an adult in the classroom who meets with all the children in the class about 5 minutes a day. So not very much, but they do it all year. These are little kids. 5 minutes is like as much concentration as they have. And what we're finding, the adults, these tutors really, they don't have a lot of experience. They don't need to create the full classroom, but they do have a tablet that tells them exactly what the students' needs are and approaches they can take for addressing them. And what we found is that just having that adult in the class moved the proportion of kids meeting proficiency at the end of kindergarten from an average of 27 or 28%, which is what the district has, in this kind of new implementation year, the first time, to something like 65% of students. It's a huge effect having an individual. Parents are also great individuals for meeting the needs of students. For many years, I've been doing a text messaging program for parents. Parents really want to meet the needs of their child, and they also have, that one-on-one caring relationship, but many parents get distracted. I get distracted because we have so much going on in our lives and can really use supports that help us focus and use the little time that we have. Again, it only takes 5 minutes, but every day for a long period of time. And we've seen really big effects at really low cost for that kind of intervention as well. So what I think on the bigger picture of those two things is it points us to the importance of adults, and it points us to the potential for technology to support those adults. We're not talking about kids on computers, but using adults to leverage, using technology to leverage what adults can provide in caring relationships to children. It gets more complicated when you go below when children go into school, because you don't already have these classrooms set up, and you don't have, as a result, don't have really easy access to parents. And so we have to think of kind of structural changes that we need to make, or ways of utilizing systems beyond our education system to reach those adults. And one example of it that I'm working on with Lisa Chamberlain, who's also here today, though I'm not quite sure where, is to leverage the health system, because almost all families utilize the health clinics, for vaccines, for well child visits. That's a way in to support parents and really reach all the parents that we need to. So I think there are lots of opportunities out there, but we really, I think, need to keep the child's experience in mind and understand that they need these broad positive learning environments, but we also need to figure out how to get them this individualized attention that really we can only do by investing in more adults in this area and by creating the kinds of technology that can help us leverage all they can bring to the children.
Just one addition to Susanna's comments, and that is, yes, literacy is important, but so is math. Children need children need individualized instruction, and I'm sure there are people out here who would say, and also science and social studies and other areas. So Sean asked us to talk about what we need to do. I'm going to start with what we have done, because we have something to celebrate in California, and I think this is happening across the country more and more. California recently had legislation that makes preschool, which we call TK because we have to be different, available to every 4-year-old in the state, regardless of their income. This is something that is really good news. It is equitable. All children have access to some form of to preschool. But that's just a beginning. And now I want to talk about what else we need to do to make sure that this doesn't actually create greater inequities rather than achieve what we want, which is to reduce inequities. So here are the concerns that I think we all need to be very vigilant about. One is participation rates. We want to make sure that the participation rates in low-income communities are as high or higher than in more affluent communities. This means we need to provide and make sure that there are resources like wraparound childcare in all of those communities, because parents can't take advantage of a 3-hour preschool or even a 6-hour preschool experience if they don't have childcare during the working hours. The other has to do with staffing. I think we need to worry a lot about staffing. Already there's a teacher shortage, we know that. We also know that in K-12, the most experienced, the best trained teachers tend to go to the more affluent schools, which means that we could have some differential quality of teaching, at least experience in teaching, that are going to exacerbate inequalities rather than reduce them. So we really need to be concerned about strategies to make sure that we're getting our best teachers, our most qualified teachers, our most experienced teachers in the communities where we need them. And in California and in many states, we also need to worry about making sure that we have teachers who can help children develop their primary language while they're developing their English skills, which is a very large proportion of California's children. Third has to do with curriculum instruction. In elementary school, there's a fair amount of research that suggests that what some of us like to call drill and kill, or very direct instruction, developmentally inappropriate instruction in many of our minds, in communities of color, in communities serving low-income children, more so than in middle-class and more affluent communities, where curiosity, problem solving, and the things that are so important to establish the basis of their future learning is. We want to make sure that the kind of curricula and the kind of instruction that occur in communities serving low-income children is what we know to be developmentally appropriate and effective practice. And finally, we need to be worried about those subtle, sometimes not so subtle, racist and stereotypes that result in, for example, a disproportionate number of children who are being expelled from school. And some of you may be surprised to know that there are quite a few children expelled from preschool. And they are disproportionately, frankly, black boys, but children of color. And that's not going to help kids. So teachers need to be prepared to understand how their own views and beliefs can color the way they interact with children, and they need to develop the skills to manage children from different cultural backgrounds effectively. So I would love to be able to pat ourselves on the back and go home and say, okay, we have universal pre-K. But that's just the beginning. And we really need to be very, very vigilant and work hard to make sure that it achieves the goal that we have of decreasing inequities.
Thank you. Rebecca?
So absolutely +1 to both Susanna and Deborah. And I'd just like to add on and really, I think it's an accomplishment that we've achieved some universal pre-K initiatives. I would love to see universal childcare initiatives so that, so that parents can have support from the time that children are born all the way through. Because right now, many families across the country are unable to find childcare, unable to afford childcare, and that's before we're even talking about high quality childcare. And so really thinking about how to put in some more social supports, like many other wealthy countries around the world do. There are other examples of this that we can model ourselves off of. So, with that vision in mind, I think I want to focus really on the educators, the workforce that is providing the care to the teachers. The last panel talked about the inequities of pay, the inequities of structural supports for these teachers. These educators are professionals and they're working with our youngest children. They need to be paid a fair wage. They need to be provided the supports to continue their education and stay in the field. There are so many educators that can't afford, even if that's their passion, to stay in the field because they don't have enough income or enough support to be able to stay in the field. And so we need these supports for the educators, but that's not enough either. So we need care, we need educators. Those educators need to have some background and support on how to support their children. So they really need to understand and be guided with, what do they know about kids' development? How can we bring that to the fore? What do we know from research about children's development? How can we bring that to the fore? We need to develop communities of practice for early childhood educators to get together and share their knowledge so that we can use that knowledge to grow and improve our early childhood environments. And then finally, we need to think about how those communities of practice can inform the curricula, the resources, the materials that are provided. Right now, there are too many resources and materials that are inappropriate for kids, that don't reflect their backgrounds, that are, frankly not helpful in integrating the skills that Deborah was talking about. You'll have a literacy curriculum over here, a social emotional development curriculum over there, and they're not integrated, and that's not how kids grow. That's not how they learn. So we also need to focus on the curricula, the resources, the supports that these educators have access to, and we need to make them free of charge so that educators across the income spectrums can really access those materials and use them to support their children.
So as Sean mentioned, I wear two hats. I teach entrepreneurship here at Stanford, and I run a nonprofit that supports innovators and helps accelerate innovation for equity in early childhood. And we're funded by philanthropy, so we're able to provide these services for free. We have a network of 400 innovators that range the spectrum from nonprofits to for-profits, early stage to larger established organizations that are looking to innovate, and they pick up on all the threads of what we heard here. So just quick context, I think, early childhood, we're already talking about going earlier and getting pre-K. It really goes even pre-birth, so there's a lot around birth equity, and we have a lot of really interesting innovators, Health Connect One, Earth, others that are looking at how we can get to more equitable starts, which get kids started on a better path. There are programs like Centering Pregnancy that help during pregnancy and continue on. And it's not just about sort of 0 to 5 or prenatal to 5 or 8. There's also the notion of, you're not going to solve this without looking at two-generation solutions. I think historically we've looked at children in isolation, and children learn in the context of relationships, social interactions, and they need that stable support. And there are a lot of programs that you wouldn't consider early childhood programs, like LIFT, that works not with children directly, but with parents and families around providing income support and career support so that they can take better care of themselves and take better care of children. I think the other theme is that there's not one solution. It's going to be a holistic set of solutions and interventions, and it's really complex, and that's where a group like ours that's trying to help get some of these ideas out into the real world. It's even harder in early childhood because it's not one system. It's health and education. Within education, it's not one system. There's home-based care, there's center-based care, there's infant care, toddler care. They're all very different. So that's a little bit of the challenge. The opportunity of that is that it's because there isn't one system like Medicaid and health or K-12 system that's universal. While that offers the potential for scale, they're also pretty codified systems. So I like to use the analogy of like in the developing world where they skipped wired telephones and went right to wireless. There is a way to network people and systems together so that we can actually innovate more than we do in some of these systems that have scale but also have very rooted paths. And so to look a little bit deeper in that, again, it's not one solution. We see a variety of innovators. There's traditional social service programs that look like home visiting, which is one of the higher kind of most evidence-based program in this area. So there's ones like Nurse-Family Partnership that's been around probably the longest, and Parents as Teachers. These were great innovations in the 70s. They're still good today, but they are and need to modernize to take into account that there is technology available, that young parents are on phones, so we need to be on phones. It can amplify some of the programs that you were talking about, Suzanne. So I think there's a way of bringing in technology to existing programs. There's a lot of parent support programs. A lot of this in the very early years is about parents as first teachers. So a lot of the, in addition to traditional home visiting, there's interesting programs that look at things like the mental health of mothers. So I'm working right now with Moms Partnership, which is a very interesting community-based program. Oh, all right. That helps moms take care of themselves and then hopefully take better care, be better set up to take care of children. There are also social services that cut across health and education. Lisa Chamberlain, who was always mentioned, has looked at innovating around kinder-ready clinics. So it's taking healthcare but looking beyond health to full success. There are, moving down the list, sorry, I'm going quickly, but I want to give you a flavor for all that's out there. Because when I talk to people about early childhood, they're like, oh, is it one thing? And the answer is it's not one thing. There's lots of things that we need to do, and they need to all be put together. So there are tech-enabled solutions, which I think is where a lot of this is going to be, because you can't replace people. You need to figure out how to supplement people. So it is about adding leverage, as you were saying. It's even more, there's some nuances to that. It's also, if we want to bring in parents or tutors, technology is really good at networking people, right? A lot of you got here today with Uber. That's like taking, harnessing people who are out in the community. There's a lot of tutoring programs and other programs that can bring some of those resources, find the people, and bring them into classrooms. It also, technology allows for data, so that you can have dashboards for teachers to know what they're doing. Lisa and Ryan are also working on data to integrate across health and education. We have decent systems for data once kids get to school, but we don't start at birth, and that's crazy, but that's the way we do things. There are other tech-enabled services around product development, around professional development. So Lena is an example. They basically have a word pedometer that counts words and interactions between caregiver, educator, and child, and they're able to convert that data into real actionable, relatively more non-biased solutions around what educators are paying attention to which children and how do they kind of increase that interaction. There are other data initiatives. Sean, you're working on that. I love your stuff, and you just put some stuff out in COVID of showing, like, at school level data inequality. I think there's real potential to harness that and kind of tie that to practice so that people in individual schools can look at what are we doing right, what can we learn from others. Steph Currington, who was up here before, is developing kind of new assessments that are that center racial equity, which is one of the themes that we heard here. They're not designed into the traditional tests. Phil and Joan are working on RAPID, which gets more rapid and community-oriented data in, so there's technology and data. And last, there's lots of traditional products, and I think there is skepticism, is can a product solve something? On its own it can't, but products can be used in lots of different ways. There's ways to assess. We have a third grade reading measure. We don't have something around executive function or early childhood development. I believe we will or should in several years' time. There are examples like Cognitive Toy Box that actually leverage technology to let kids play a game. So you actually think there's an advantage where technology helps children. A lot of developing the skills of executive function can be sort of assessed even before kids are reading by using a tablet So that's Cognitive Toy Box is just one of many examples there. There's an innovation out of academia in both Boston, in universities and in hospitals called Early Bird, which is assessing learning differences even before children are learning. There's a lot around childcare search, which doesn't work very well. It's kind of interesting. Most of the childcare search is developed by counties. And I looked through all of my apps on my phone. I don't have a single app that was developed by a county. Maybe I have some by the, by some nonprofits. And so I think leveraging the private sector where they're good to work with public sector. And that leads to the last one, which is this, there's a lot of opportunity for public-private partnerships, which is everything for things where we did see innovation during the pandemic around childcare search for essential workers that actually worked and provided more real-time data. There are public-private partnerships around, or I think there's actually potential where there's new, well, we're not getting action at the federal level yet. There's a lot at state and local level to have ballot initiatives to bring more money in. And so I think this is part of what we're trying to do here is rally more people to figure out how we can bring more public attention. And last is employers. I hope we don't end up with an employer-based early childhood system, but that's what we have with health, and it's not ideal, but at least we have decent coverage with health. I think there's some innovations for employers who are looking at childcare being critical, and if we can help that, help with access and supply and quality, that would be good. And by the way, a lot of the initiatives, including one just recently out of Stanford, a team called Patch Caregiving is looking at doing this for frontline workers who are often lower income, often black and brown employees. So I think that's what's encouraging is that there's a lot of challenges in the field, but there's lots of green shoots, and I love the opportunity to expose some of these great innovators who have great ideas and need more help and resources and scale.
Thank you.
Yeah, so hi everyone. I would like to make really one key point, and that's addressing the implications of the income achievement gap during early childhood requires strategic investment during pre-K and beyond into later years. So it was actually with distinct pleasure that I learned that my good friend and colleague Sean Reardon, to next to me, just recently took on running as a hobby. So setting aside the question of how well he is currently doing in his hobby, there's actually a running metaphor that helps, I think, illustrate my point. It's actually a track and field metaphor. So my favorite events in track and field are the relays, 4x1, 4x4, 4x8, really any of the relays. There's something to me deeply appealing of the idea of a relay team working individually but collectively, right, and sequentially, motivating one another, potentially building off or compensating for the performance of others, right? That's always intrigued me. Track folks generally know that having a good first leg is helpful, right? Having a fast first leg matters, right? It essentially gives your second leg a head start for their portion of the race, right? But we know that having a fast first leg isn't the only thing that matters, right? Certainly when it comes to winning a race, having a fast first leg could prove to be inconsequential if your second leg is forced to wear heavy shoes, if your third leg is tripping over items on the track, if your fourth leg can't even turn around to grab the baton because he's in handcuffs, right? So similarly, one would look skeptically at a coach who said that all that's needed to win a race is to have a fast first leg, right? But what's interesting is that coach has more or less been alive and well in the early childhood space for some time. That is the belief that for children to win the race, that is to go on to lead healthy and productive lives as adults, what they need is a really fast first leg, right? What they need is really strategic, intentional investment during their early childhood years. That if we can get that investment specific enough, robust enough, then we can essentially inoculate children from the inequities, really the machinery of inequality that churns through the K-12 system as well, right? And we know that there's aspects of that sort of belief system that do hold true, but we know that that's incomplete, right? You've got some ongoing work in Tennessee where we found that 10% of low-income children who are able to attend a high-quality preschool, just 10%, 1 in 10 of those children go on to have what I refer to as access to adequacy in their early elementary years. That is access to learning environments that we would reasonably expect to, at the very least, sustain the benefits accrued during early childhood, but at best amplify those benefits, in their early childhood years. Right? Other scholars have got at this idea, right, of the complementary role of early investments and later investments, right? Dynamic complementarity by my colleague Rucker Johnson, gets at this point as well. Right, that investing during the K through 12 years in strategic ways can actually amplify benefits early on, right? And likewise, investing in early childhood can actually amplify later benefits or later investments, right? So really what's gained by sort of a broader conception of sort of tackling inequality, understanding early childhood investments in a broader sort of developmental frame, right? Really what's gained is, we are better able to ensure that children who are positioned to run a really fast first leg, right, because of the opportunities available to them, because of the strategic investments that we've been able to set them up with, right? We can ensure that child, when they get to that second leg, when they're enrolling in kindergarten, ready to really begin the heart of their K through 12 experience, right? We can ensure that second leg has the same resources, has the same opportunities, right, to run fast enough to keep up with Sean when he's running around campus early in the morning. So.
Thank you, Alvin. So I'm going to pick up on Alvin's running. I'm going to pick up on Alvin's running metaphor and tell you why he brought that up. So Alvin knows I've been running because he was driving his daughter to school a few weeks ago, and they saw me and my wife running, and his daughter apparently explained to him that I was a pretty bad runner. Like, he said, "Oh, that's my friend Sean," and she said, "Ooh, the one who's really uncoordinated." So thank you. But the coordination point, actually, you can't be a good runner if you're not coordinated. And so one of the things I was thinking as you all were speaking was, you've described all sorts of different innovations, from sort of state policy changes to instructional changes to things that happen in the healthcare system, to private sector innovations, public sector things. What are the challenges in thinking about a sort of coordinated approach to early childhood that makes sure that low-income children don't fall through the cracks? Because we don't have a kind of universal system that attends to children, what are the challenges, and how can we make sure that some of that great, exciting efforts that you guys have all described don't end up sort of uncoordinated and looking like I do when I run, apparently?
Well, one is to have a universal system for early childhood. I mean, I think that's one thing that we should be aiming for. And it doesn't have to be a kind of super structured from the top system, but we should have a way of understanding what students or what children are receiving and what their experiences are, so that we know where the needs are and we can invest in those places. And I do think that having, just like in K-12, having some standards and having the high quality instructional materials and allowing choice, but with lots of options out there that align, is going to be an important part of pulling this together.
Other thoughts?
I think it's partly a cultural change, and I'm going to pick up on the relay, which I thought was a great metaphor, because we have K-12, we have preschool, we have infants and toddlers, and then we have medical centers, and we have schools and so on. We really need to think of, and I was going to say P-12, prenatal to 12, not preschool. We really need to start thinking of development on this continuum. And I don't think we're going to have superstructures. I'm not sure we even want superstructures that sort of, where somebody is kind of managing all aspects, but we certainly can improve our communication and connections, so that people who are preschool teachers know a lot about infants and toddlers because they need to know where kids are coming from, what they're learning, what their development is. They need to know what's going on in kindergarten because they need to know what they're preparing children for. Kindergarten teachers need to know, and in fact, a kindergarten teacher isn't really a kindergarten teacher. A kindergarten teacher is a preschool through first grade teacher because that's the range of skills, both social emotional skills and academic skills that kids bring to the classroom. So we need to think of this continuum and embed it into both our institutional structures, our training for people, our support for people, so they're more aware, and the communication among these various structures.
Yeah, I think there's two things. One, we subscribe to targeted universalism, that if we can focus our efforts most on the children that are facing the greatest adversities and have the most systemic obstacles in their way, those solutions tend to benefit everyone universally, and I think that's a common theme that you've heard up here. I think the second is more of a cultural one, that it is, we can't look in relay segments or in silos. All fields suffer from silos, but I think this one more than others, because it's not a field. It's, as we said, it's health and education. The education changes a lot. So I think it starts with a mindset, and that's why I'm excited about the center, and I think Stanford is a good place to do it for two reasons. One, Stanford is very interdisciplinary by nature. This group was formed that way. There's a really tight connection between health and education and others, business and the like. So I think it is building on that. And I also think, as someone who's done some work at the D School here, taking the human-centered design approach lets you look at it from the human standpoint and not then just create systems. As we said, that's not the way to solve it. And it's a very simple idea, but it's a powerful idea. And it starts, we talked about this in the Leadership Council for this yesterday, that even going from prenatal to birth, it's like obstetricians don't talk to pediatricians. Like from a human-centered standpoint, 1 minute you're with an obstetrician, the next minute you're a pediatrician, and that carries on through the system. So if we can think of the human first, sounds simple, design around it, and then bring all of these other systems together, I think we'll have a greater chance for success.
Yeah, so I think a lot about that pre-K transition, right, and ways to facilitate a positive transition, right? And there's been a lot of work on this front over the last several decades, right? We know that curricular alignment is important, right? It's remarkable the degree to which curriculum at the pre-K level is misaligned with that during kindergarten, right? Kind of a simple intervention on that front. That is curricular alignment, right? There's another idea that actually I talked a bit with my brilliant colleague Jelena Abranovich, who you'll hear from later, and that's the notion of assessments as intervention during early childhood, right? This idea that assessments broadly conceived, not just cognitive per se, socio-emotional assessments, really to understand the various assets that children have, right? How those assessments can be used to inform their early trajectory in school, right? How much more valuable are the first several weeks, if not the entire kindergarten year, when a teacher has an understanding of a child's full sort of skill base, right, and asset base and strengths and the various strengths that they show up to the classroom with. So those are kind of two kind of simple ideas that can kind of help facilitate that transfer, pre-K to K transfer.
And I'll just jump in and kind of building on what I was talking about with supporting educators. I think the field is very also disconnected in how we prepare early childhood educators versus K-12 teachers. And I think that needs to have some realignment so that we are, working with early childhood educators and K-12 teachers together so that they can develop this understanding of child development throughout the lifespan, and they can understand what each other is doing and create this more community of practice amongst educators, because right now those systems are completely separate as well.
Yeah. Can I just jump in? And another win in California that's recent is that we now have a new teacher credential, preschool through third grade. And the purpose of that is to make sure that those preschool teachers and the third grade teachers and everything in between are prepared together and understand each other's roles.
So, Deborah, I want to pick up on something you said earlier, which is we have this new universal pre-K, TK in California. But you're concerned that there's the danger that doesn't reduce inequality by itself, that we have to attend to it. And a lot of the things that many of you described were things that could be beneficial to all children, or that might be things that even high-income families would be able to take more advantage of. So how do we think specifically about the inequality reducing aspect of these? How do we take the kinds of strategies you've all described and deploy them in ways that reduces inequality, not just sort of helps anyone who can take advantage of them?
Do you want me to answer?
Anyone?
You start and I'll go.
Well, I think I gave a specific to transitional kindergarten, and some of the potential for inequalities there is to develop incentives and make sure that we get the best teachers into schools serving low-income kids, and also to provide ongoing support, because however well you're prepared isn't enough to be a really effective teacher. To make sure that there are resources available, and to make sure you've got wraparound care services in all communities, especially in the communities serving low-income kids. So I think there are a variety of ways. Once we understand the potential for inequality, we can put our heads together and find strategies to make sure that those potentials for inequality aren't realized.
Yeah, I think I just want to second that there is a role for kind of learning from experience in a continuous way, so that just because something is available doesn't mean that people have access to it. But we have to learn whether or not whatever it is that we're providing, or that California is providing, is useful, is taken up. That's something we just have to kind of see, and there's a role for data, there's a role for people who are looking at it, because we're never going to get it right the first time. It's not like we know exactly what fits every context, but we have to be, that's why we have to be so cognizant of these inequalities that are likely to be out there, so that we can see if they're there, see if whatever's going on is reducing them or magnifying them, and then react. So I do think we have to kind of think often about creating these kind of feedback loops and this possibility for continuous improvement.
Just I think on that, creating the feedback loops, a lot of, it's more of a process-based answer. I think most solutions are not authentically co-created with, with the children, families, and providers that are going through that. And I think that's true from everywhere, from policymakers I've talked to through to entrepreneurs creating products. And so I think making sure that we really work, which is hard work and new work, around how to do that, because it's, some of it is just what we teach in entrepreneurship around get really close to your user and understand. I think the other element is some of the people who are doing that are not close to the problem, so it's understanding, structures of inequality, power dynamics, and being sensitive and figuring out how to overcome them, and also focusing on more proximate leaders. And so we have programs around that, is make sure that we get more voices, setting policy, influencing policy, building products, working on implementing products.
I'm going to let Alvin and Rebecca answer a second, but if you have questions from the audience, we're going to take those next. So make your way to a microphone while we hear from Rebecca and Alvin.
Sure. So I'll actually build on what you were talking about in thinking about how I was talking about developing the educator workforce. I think we need to work in communities to develop educators in those communities. I think those are the people who know the children the best, they know the families the best, they have those interactions. We need to bring more people from the communities into the profession and scaffold them and support them in developing their careers, becoming the professionals that they can be, and I think that will help to keep the educators in the communities and retain them over time, so that they feel dedicated to supporting this particular population.
Yeah, I just wanted to add that, interestingly, there's something inherently unequal about the nature of early childhood investments that can actually function in a compensatory way. And that's, we actually know that children respond differently to early childhood interventions, right? And those heterogeneous effects generally fall in line with the story that the children who benefit most from early childhood investments are the most disadvantaged of our population, right? So when we're thinking about kind of rolling out, expanding pre-K access, we need to be sort of critical and mindful of the fact that, to the extent that we can assure that the children who benefit the most have ready access, right, can do quite a bit of work in terms of reducing inequality. In some work that I have, found that ongoing work, that children most likely to benefit from early childhood investments are actually the ones least likely to have access to them, right? So those issues related to transportation-related issues, network-related factors, right, communication factors become really critical in this story of reducing inequality in the early childhood space.
Thank you. I see one question over here, it looks like.
Thank you, Sean. Hi, I'm Glenn Kleiman. I'm a senior advisor in GSE at Stanford in the Accelerator. And thank you all for the inspiring work you're doing, bringing all the pieces of early childhood together. I'd like to ask about one piece that I haven't heard that much about yet. And this really reflects conversations with my wife, who's a pediatrician and used to run a high school-based health clinic. And she's often remarked she worked with families, often with very young parents, who the parents themselves, of course, wanted the best for their children, but really didn't understand nutrition, healthcare, social, emotional, cognitive development. And I haven't heard much about a parent education component or supporting parents in that situation. Where does that fit in this, putting the pieces together?
I'm supposed to talk about. Yes, I mean, I think that's essential, and I think a number of us have touched on it a little bit, is that parents care so much about their children, and they have great potential to support them, but they also face a lot of challenges. Some of it is not knowing things like nutrition, but others is just being able to handle what can be very challenging for everybody to go through. And so I do think one of the important things we have to do in early childhood is just make it much easier to be a great parent and to create strong learning environments, healthy, nutritious, whatever you want, just great lives for kids, and that parents need better supports than we're providing. One thing Sean said as we started here, right before we were walking on, is that one thing we shouldn't forget is that one of the best ways of addressing all these is to reduce the inequality that we have in income in this country and reduce poverty in the country. And so I think that, of course, is the first and the most fundamental, but given the world that we're in, we really have to figure out ways of supporting parents better. And part of that is providing these places that children go to outside of the home, but the other part is just making the home a better place for both the parent and the child.
And then I think building coherence, the coherence that we've been talking about between the educators and the parents. I think right now, parents, there's not as much communication or collaboration as there possibly could be. And so how can we create communities of practice within parents and educators working together to support children? I think that could be really powerful.
And there's much more alignment. Like you talked about, teachers aren't well trained. There's not good canonical training for early childhood educators. There's a lot more alignment between what parents need as first teachers and what early childhood educators need. So I think that's one of the opportunities that we've talked about, is how do we just create that foundational set of supports that work for every parent and is,
When you started, I thought you were going to refer to community schools, and that was something else that hasn't been mentioned here, because the community schools is a place where the school really connects with all the community organizations that provide the different resources, whether it's social welfare or pediatricians and so on. And so it is kind of a place where you can do parent education, where you can really enroll the whole family and make a central place for those resources to be available. So it is one innovation that I think we should be looking at to expand.
The community schools and their importance. I'm so glad you've raised that also. So thank you.
We have another question, I think.
Yeah, actually, I want to make an observation and then get your feedback from it. Alvin, what you said before that last question about the kids who get the best benefit from early childhood are the ones who need it the most, who are the most disadvantaged. I'm Debbie Berger. I'm from the National Head Start Association, And prior to that, was with the Office of Head Start as the director. And before that, I was a K-12 person. So I kind of have this weird dynamic perspective here. But what I noticed when I was at OHS quite quickly was this huge sort of tension, and I think even Kelvin sort of alluded to this earlier, between like a Head Start program and another pre-K, really school system, more universal pre-K, and so started to work on some of those things. What's interesting about what you said about making sure that as we expand pre-K, that we make sure we're meeting the needs of those children who need it the most. How do you think we coordinate the system so that a program like Head Start, which is designed specifically to meet children living below the poverty line, so we're talking about the most vulnerable children, and that new funding and new programming doesn't supplant that. I think of a conversation I had early on with a superintendent when I was at OHS who was so proud of his new early childhood program. And he was very proud of the fact that he was enrolling the most vulnerable children first, and he classified that by poverty level, and that he had a waiting list. It was so popular he had a waiting list. But the Head Start down the street was under-enrolled. And so what he had done without even intentionally doing that had enrolled all his Head Start kids, but Head Start couldn't enroll the kids on the waiting list because they were above poverty level, still really in need. 200% poverty is not, you're not sitting pretty at that point, right? But those kids had no access. Really weird little, and so systematically, how do we do this great work of growing this and take advantage of the Head Starts that are out there and the pre-Ks that are out there and the child cares that are out there and not step on each other's toes without making it one big same system, which I don't think serves parents and children best. How's that for a loaded last question?
Calvin?
I mean, you might have a seat. I think you, in many ways, I appreciate how you framed up that issue. I think what you're referring to is the great tension and trade-off that occurs with scalability, right? As you scale, you're necessarily serving a broader swath of children, right? A broader swath of children will necessarily have different needs, right? Different strengths, right? To me, the way that I think about that issue is the need to retain notions of heterogeneity within programs, right? Every program is not ideal for every child, right? There are things that Head Start does that's incredible, right? That certainly meets the needs of a particular subgroup of children, right, with those particular needs. So I think when we're talking about pre-K expansion, right, the scalability, scaling up programs, we need to kind of keep within that conversation sort of key sensitivity to the importance of differences within programs.
Just one quick thing is that I understand in the particular case that there was this tension, but I think across the country, as I'm sure you've seen, one of the benefits of the expansion of pre-K is Head Start's been able to serve more 3-year-olds. Mm-hmm. And so I think, and it's really important to be able to serve those 3-year-olds, and it would be a shame to think what we really want ultimately is one program for the poorest kids, one for the next poorest kids. You know, we don't want to differentiate programs, I think, according to Calvin, by the income of the family. So I agree it's not working perfectly, but there are some benefits to it, and I think we should try to embrace those and figure out how to get more from them.
Thank you very much.
I think we're at time. I want to just conclude with a few kind of overarching comments. One is I think that the panel has highlighted the possibility for solutions that operate at the policy level, as well as the kind of program and the innovation level in the private sector as well as the public sector, and also innovations that happen sort of through the healthcare system as well as through the formal pre-K system. And so I take away from that a lot of optimism about there's a lot of avenues through which we can tackle this problem. I also take Susanna's point that reducing income inequality might be a good place to also focus some energy. The other thing I take away is a lot of exciting stuff is happening. There's a lot of people focused on this, and I think one of the things that I hope the center can do and the field more generally is figure out how to use all of that enthusiasm to identify the things that are most promising for reducing inequality and figure out how to scale and coordinate those so that they make a real difference. So I want to thank you all for your sage comments and for being here today.